So this bill is really important for several reasons. One is it ensures fair access to mental health care. And not only access, but affordability. And so if you cannot find an insurer that, or a provider that will accept insurance, especially if you're talking about Medicaid, then the accessibility goes out the window. So this is, mental health is one of the big issues that all of our communities face. This nation faces. And so we have to make sure that we have accessibility and affordability. We have to be able to hold insurers accountable. These things don't just happen on their own. I think people oftentimes when they see things that are provided in society, they think, well, that's just because these folks really want to do the right thing. Not always. And so we have to put these kind of guidelines in place to say, okay, here's what's important to the population, and here's what you have to do to meet that need. And this is one of those cases. It protects families and communities. There's not a single one of our communities that are not struggling somehow with issues of mental health, whether it be adolescent mental health, whether it be adult mental health. This is a crisis issue for all of us. It improves not only the quality of life in our communities, it improves workplace stability. It helps just across the board. So this is an important bill. And it's a bill that's going to pass, and Representative LaPointe mentioned that this is a bipartisan bill. This is going to pass not only because we have excellent sponsors in both the House and the Senate, with Senator Villa carrying it in the Senate, but because this is an issue that our constituents in our communities demand. They want to be able to solve this problem, and we're going to help them do that.
Although my title now is State Senator, my favorite title that I've ever held is Ms. Villa, School Social Worker. As a school social worker, I would work closely with students and families. Sometimes a student would come in and disclose some issues with anxiety, some issues that were, yellow flags for potential issues with depression. I would call the parents in and have conversations with them. Now imagine yourself in that moment. You're at work and you get a call from the school social worker asking you to come in to have a conversation about your child. You go in, and upon hearing some of these issues, you do what's right. You call your insurance company. The same way that you would call if your child told you, I have some pain in my tooth, you'd call to see what dentist is available through your insurance. So the first thing you do is you take this very seriously and you call your insurance to try to find out who your providers are. Who are the options for your child to go and see a therapist? Lo and behold, the list is maybe 8 weeks, maybe 2 months. In that time, you say, okay, I'm going to take that appointment. In the meantime, I'm going to keep an eye on my child. You notice the anxiety increasing. You notice the child potentially saying, I don't want to go to school. The child potentially not wanting to get out of bed. You start seeing these signs, and as a parent, you're feeling so desperate, you don't know what to do. You call that school social worker again, and you say, what do I do? In that moment, the social worker gives you a list of referrals, but again, the wait lists are unbelievable. So you find a therapist, finally, that'll take cash payment. Think about that. You've been paying for your health care. You've been paying for your insurance. But you have to now start paying $150, $200 out of pocket just to get your child the help that they need and deserve. This issue now is escalating, and you're seeing it in your child's face, and as a parent, you think, what have I done wrong? But that's the wrong question to ask. You have done nothing wrong. You have paid your premiums, and you deserve for your child to be able to go in and get help when they need it. This bill is the most important bill regarding mental health that we can make sure to get across the finish line. Our children and ourselves. That story doesn't just go for children. That story goes for us too. If you're feeling anxious and depressed, and you want, and as an adult, to get assistance and help, it's almost impossible to get on those lists, to call your insurance provider and say, give me a list of names. House Bill 1085 passed today out of committee. It's going to pass on the floor. When we get it in the Senate, as Leader Kaler said, we are fully committed to making sure that this bill gets across the finish line for the people of the state of Illinois.
Thanks for watching this video. Please like and subscribe to keep up to date with news from the caucus. For more information on what the Senator is working on, please follow them on social media using the links in the description below.